Hello, my name is Subhash, and in this video I'm going to highlight the full spectrum of biological risks. Biological risks, in short, we can call biorisks. So this video will be useful to the students, adult learners and anyone who is interested in learning more about the biorisk management from One Health perspective. So the main purpose of this video is to promote the One Health and biorisk management. So first thing first. So before I talk about the full spectrum of the biological risk, I want to introduce you to some important terms. Those are very commonly utilized in biorisk management. So hazard, this term hazard is nothing but a source or situation that has the potential to cause harm. Okay. Then another term is a biohazard. So biohazard is nothing but biological agent, their derivatives or toxins derived from them, which has the potential to cause the harm. Then this is another term, threat. So threat, here we are talking about a person. So person who have the bad intention or ill intention to cause the harm. Then there is another term which is accident. So accident means unplanned, unpleasant event. So accident can happen in the laboratory, accident can happen in the field when you are going for collection of the sample or some other purpose. Then risk. Risk is nothing but something bad or unpleasant will happen. And to be precise, risk can be defined as the likelihood of something bad will happen involving the hazard, to be precise biohazard, and or threat and consequences of that occurrence. So that one is a risk. Okay. And when the biological agents or toxins or their derivatives are in all, so that one we call biological risk or biorisk. Okay. Then biosafety. Biosafety is, broadly speaking, biosafety is nothing but when we are working in the laboratory, we need to protect the laboratorians, researchers, academicians, students, and those are working in the laboratory. So we need to protect them. So whatever the control measures are taken to protect them, so that one is called as biosafety. Then biosecurity. Biosecurity is to prevent the theft, misuse, intentional release, unauthorized access. So all this is covered under the biosecurity. So the ultimate aim is to protect the dangerous pathogen from the bad people, those have bad intention. Okay. And this biorisk management, so this one covers both biosafety as well as biosecurity. Okay, so now I am going to highlight the spectrum of the biological risks. So natural outbreaks of diseases, so this one is one of the source which makes people or animals sick. So for example, if you take the example of agricultural workers, frequently they come in contact with the soil, then animals or wild animals as well as plants. So when there is a spillover of the pathogen from these plants or animals or soil, so they get infected, and if it's not controlled in time, it may result into the outbreak. Okay, so then this one is another one, emerging threats. For example, antimicrobial resistance, emerging threat. Okay, so this one is a big challenge for the humanity because many microorganisms are developing a resistance to the drugs and antibiotics. So currently, at least more than 700,000 people are dying because of the antimicrobial resistance every year. Okay, and according to one report released by United Nations ad hoc interagency coordination group, which is working on the drug resistance or antimicrobial resistance. So according to their assessment, 10 million people will die every year by 2050. So you can understand how big challenge it is. So this one is the emerging threats. Then another one is laboratory accidents. So while working in the laboratory, researchers, academicians or students, any accident can happen. That accident, as a result of accident, they can get exposed to the microorganisms. Those are handled in that laboratory, and it can lead to the lab acquired infections, and if it's not controlled in time, it can result into the outbreaks. And sometimes it can go beyond the control. We don't know. Maybe next pandemic could be from the laboratory. We never know. So next one is laboratory negligence. So this one is, for example, you take the example of clinical laboratories. So the collection of the sample, handling of the sample, testing the sample, interpretation of the data, then keeping the recording it properly. So there are a number of steps in our living. So when there is a negligence, so that one can also pose the risk to the patient's life. Sometimes maybe that patient don't have that disease, or patient is not having that illness. So but it is wrongly diagnosed because of the negligence in the laboratory or diagnostic laboratory. Okay, so then this is another one, vandalism and sabotage. So just I want to give one example. For example, environmental activists. So when they come in any research institution or diagnostic laboratory or laboratory where the different microorganisms or samples are handled, so when they do the vandalism or sabotage, so as a result of that one, there is a risk these microorganisms, the biological agents, their derivatives and the toxins can be out, and people can get infected, and it can result to the outbreak. It's possible because risk will be never ever zero. Keep in mind. Okay, then this one is another one, deliberate misuse, including the bioweapons. Okay, so this one is sensitive, but this one is very important because when people those have a bad intention, so by different means they get hold of the pathogens or the microorganisms or the select agent, so they can misuse, and it can be used as a bioweapon. For example, you know the story of the anthrax attacks in the United States of America. So it can happen. So that's why the biosecurity is very, very important. So this is the whole spectrum of the biological risks, and this risks posed by all these different sources needs to be mitigated. And that's why this biorisk management, biosafety, biosecurity comes in picture. So this biorisk management covers this one. So this natural outbreaks of the diseases, emerging threats. So this one is handled by the professionals in the healthcare sector. So I mean by the public health department. Public health is nothing but the science and art of preventing the disease. Okay, I mean. The whole definition is very long, but the ultimate definition or the purpose of this public health is nothing but public health is nothing but the science and art to prevent the diseases. So the health professionals medical doctors, nurses, epidemiologists, then other professionals. So they deal with this natural outbreaks when the patient goes to the hospital or clinic. Then this emerging threats. So then in case of the laboratory accidents, laboratory negligence, vandalism and sabotage, deliberate misuse or bioweapons, all these things is related to the laboratory setup. So in this case, the biosafety and biosecurity is very essential. And in order to mitigate the risks posed by these different sources, so we have to mitigate it by practicing the biosafety and biosecurity, and for that purpose the effective biorisk management is very essential. One thing I forgot to mention, so one more, the emerging area is coming. So that emerging area or the discipline is called as cyber biosecurity. In this one, but cyber biosecurity is at the intersection of cyber security and biosecurity. Because in biology and biotechnology or medical biotechnology, we have made tremendous progress, and we are heavily relied on digitization, automation, which have overlap with the cyber element. And because of this one, so this one creates new vulnerabilities, or it makes us vulnerable because cyber intrusions, if it happens, so the important data can be stolen from the institute or center of excellence or sequencing facility. Then information theft, sensitive information, which is very important from this perspective. For example, bioweapons or the other elements, for example, emerging threats. So if there is some sensitive information, it can be stolen by cyber intrusion. Then cyber biosecurity. So if it's not addressed properly, so the people, those are involved in that one, so they can also use this as a tool for the malicious destruction. Okay, so when we are addressing all these elements or the full spectrum of the biological risks along with the cyber biosecurity, so that means we are looking at the holistic picture, and when we are addressing all these problems holistically from One Health perspective, so that one maybe we can call as an integrated biorisk management. So when I talk with the students or when I give a talk, so I refer it as a integrated biorisk management. Okay, to summarize, so the full spectrum of the biological risk includes the outbreaks from the nature or the natural outbreaks, emerging threats, laboratory accidents, laboratory negligence, vandalism and sabotage, deliberate misuse, including bioweapons, and just now I have mentioned the cyber biosecurity. So to mitigate the risks posed by this full spectrum of the biological risks, we need to have an efficient and effective integrated biorisk management. So I hope this one help you to recognize the importance of the biorisk management or integrated biorisk management. Thank you very much for watching.